Periimplantitis is one of the greatest challenges in modern implant dentistry. Approximately 20% of dental implant patients are affected. As an expert in implantology, I see periimplantitis cases on a daily basis. Periimplantitis not only compromises the actual implant and well-being of patients, but also their trust in implant therapy. Periimplantitis treatment requires precision, implant-specific instruments, and a deep understanding of the disease. Scientific studies have shown that dental instruments can actually abrade the implant surface and contribute to long-term inflammation and possibly even bone loss. This is where a new periimplantitis-specific instrument workflow comes into play. Together with experienced designers, we designed this kit with implant specificity in mind to combine precision and ergonomics while safely cleaning implants. The uniquely shaped instruments, created from a soft titanium alloy with zirconium nitride coating, are created in a very unique way to address the challenges around implants and maintain them without damaging either the tissue or the dental implant. With this instrument set, we can improve treatment outcomes without damaging the implant surface and ultimately give patients the outcomes that they expect and deserve. Clinicians are often concerned with using conventional steel metal probes around dental implants to avoid damaging the epithelial tissue attachment and poking through the tissue. Also, the rigidity of metal probes doesn't allow them to go under the concavity of the abutment to look for implant-specific risk factors like excess cement. We begin with the peri-implant probe, which is much more elastic than an actual stainless steel probe, and the reason is that this elasticity allows for tactile perception to compensate for the less robust epithelial soft tissue seal around dental implants. So before the tissue ruptures, we will have tactile feedback that will allow us to stop the probing right at the right pressure point. So the first step in an implant maintenance or even a non-surgical implant therapy workflow would be to use the elastic probe to probe around the dental implant with the purpose of 1, assessing peri-implant health by measuring the probing depth, and 2, assessing for peri-implant calculus, which usually localizes on the implant abutment and doesn't go on the threaded part of the implant surface below the gum line. In the stepwise workflow, the second instrument is the soft titanium curette, and its purpose is only to very locally remove calculus if it's visibly present in the implant abutment. And the intent of the titanium curette is not to blindly start abrading the implant surface, the threaded implant surface, because simply scientific studies show that titanium curettes are not effective in removing submucosal peri-implant calculus. The next step of the periimplantitis maintenance workflow includes a uniquely designed instrument which is called the Impla-Safe Cement Explorer, because excess cement around implant restorations is one of the primary risk factors for peri-implant inflammation and periimplantitis. This instrument is uniquely designed to fit underneath the curvature of implant crowns and is very elastic to provide tactile perception and allow us to identify excess cement that is trapped within the tissues and produces inflammation. The next step in the workflow, if excess cement is detected, is to be able to remove non-surgically that excess cement. For this purpose, there's a unique instrument, the Impla-Safe Cement Remover, which has micro-serrated edges, and the intent is to engage where the explorer has identified the excess cement, and after engaging, remove in one stroking motion the excess cement, and we usually can see that coming out of the peri-implant sulcus. This is also a very useful instrument at the time of cementation of implant crowns to be able to remove the excess cement primarily before it becomes an issue. The last part in an implant maintenance process is to use designated brushes or coated ultrasonic tips or any other intervention that is safe and non-abrasive for peri-implant biofilm removal. And in the end, a key part of removing biofilm is simply burnishing the implant surface. So what we recommend to do is soak regular gauzes in saline and then use the micro-Adson titanium coated pliers to be able to apply the gauze on the implant surface and burnish it and remove any excess biofilm that has stayed behind. After that point, the last step is to profusely irrigate the sulcus, and that completes the implant maintenance or non-surgical periimplantitis process. The use of implant-specific instruments minimizes damage to the peri-implant tissues and the dental implant, leading to improved clinical outcomes, and helps build safety and trust between the practitioner and the dental patient.
We create safety together.